Good evening. If you can see me, if you can see us, that can only mean one thing. It's Mental Health Monday. All right, and we are back. Welcome to another edition of Mental Health Monday, brought to you by Saving Grace Community Church and Grace House Cincinnati, a nonprofit agency and ministry of Saving Grace Community Church. I'm Pastor Trevor Phillips, along with Dr. Quentin Moss, founder and chief medical officer of Mighty Psychiatry. We welcome you. Good evening, my friend.
Good evening, brother. Good to be here, man.
It's a great day to be a Bengals fan. Who they?
The miracle took place this past Sunday, didn't it?
Yes. I believe Scripture says the effectual fervent of the prayer avail of the righteous avail of much. Miracles do happen.
Yeah.
On this day, Dr. Moss, we want to continue our discussion because once again we are so inundated. We are so really in the throngs of the pandemic, and with each day comes more news. With each day, there's more reporting on where we stand and where we are. Last week, we just talked about the crisis in general and specifically those who lost their lives to COVID. And today, we just want to lift up and talk about frontline workers, people who are really on the front line, risking it all. Those that are right there giving care, those that have subscribed and have made the pledge to do no harm, but are putting themselves in harm's way.
That's right.
So that they can serve and be healers. I want to pick it up from last week. We were talking a little bit about, as we're about to enter into another phase in our conversation, this whole thing about homeopathic remedies and the effects of that and a lack effect of that and the science or no science in it. Give me your thoughts on that, Dr. Moss.
I think that the best science points to vaccination. We've heard a lot about zinc and vitamin D, and there may be some benefit there. But the science points to vaccination being the best approach to protect ourselves from COVID-19. It's interesting. We've gone from Delta, which was highly virulent and unfortunately killed a lot of people, right? High severity of the illness if you were to catch the virus. And now we've moved on to Omicron. Now, Omicron is actually a lot easier to catch than Delta was. But we're seeing that perhaps this is a milder form of the virus for most.
For
most, which means that there are some people who are catching Omicron and they're still getting very sick. We still have some people who are catching Omicron and they're ending up in the hospital. Much fewer than we had with Delta, but we still have people get very sick from this virus. So it raises the question, the virus is going around, it's easily to be caught. Should I just weigh perhaps just catching the virus versus getting a vaccine? And the science points to you're better off getting the vaccine and making sure that you're boosted. You don't know what your body's response to even Omicron is going to be. So again, for most folks with Omicron, they're able to have some symptoms, but not warranting being in the hospital or in the ICU. But still, even today, there are thousands upon thousands of people across the country who are in the hospital and in the ICU in the midst of this Omicron variant. So why roll the dice? Do the safer thing. Get yourself vaccinated. If you've had the 2 vaccines and you're in time for getting boosted, get yourself boosted and make sure that you're well protected.
Is there any truth to this thing called super immunity?
So they're looking at, people who've had the series of vaccines and who've also had the infection with the Omicron variant, and they may have, greater immunity with the accumulation of all of these things, right? Having an infection and also have had the booster, right? But no one, I think, should try to make themselves super immune by getting infected. Do the safe thing, which is to get your vaccinations. And if you're in time for your booster, get your booster.
Our former president was a proponent not only of putting bleach in your system and see if that might work, but our former president really spoke and really was a proponent of this whole herd immunity, and that if everyone catches it, then it won't be an issue. But of course, we know, as we've stated, that it disproportionately affects some people as opposed to other populations because of lack of access to health care
Right.
and the underlying conditions. The question needs to be asked today: are we anywhere close to herd immunity? And clarify those that would say that herd immunity is our way out of this.
Yeah, I don't know the answer about herd immunity. What we do know is that when people initially had discussions surrounding this, there was a calculation, and the calculation was that so much of the population would have to reach some sort of immunity, and that immunity can come from catching the virus or possibly from getting vaccinated. If we're to look at people catching the virus as a way of trying to get herd immunity, that comes with a cost. That comes with a cost in our system in regards to people who have to receive medical care, which then trickles down to other people not being able to receive sometimes routine care, cancer screenings, treatment for heart attacks and strokes. So there's a big fallout to the system when we try to put in place this whole thing of herd immunity. And secondly, the second cost to that is that, we're going to have a number of people who are going to die. If we look at this as we're going to infect our way out of this, we're still going to have the toll of unnecessary deaths from folks catching this virus. So the best approach, again, and I'll continue to mention this, is to receive your vaccines, to get your booster if you're in the timetable of getting the booster, so that we can best protect ourselves from getting, very sick.
It's unfathomable. It's unimaginable just to think where we would be without the boosters. I mean, with the boosters and with access to vaccination, the booster and vaccinations, again, we have lost over 866,000 people in our nation, and an additionally 70 million people have been infected. And so to say that 866,000 folks lives are not important, or just one life being lost to this pandemic is not important. To push herd immunity speaks to me of some folks who really are detached from what it means just to be a human.
It's a troubling situation as we look at the effects of what the virus has done and what it's done to our healthcare system. So we talked about, delayed cancer screening. So what does that mean, Dr. Moss? So that means that people who would have gone in for mammograms or colonoscopies or pelvic examinations, other ways that we try to detect these various cancers, those things have been delayed. So now we're having people to come back in a year and a half later. A year and a half is a long time when we think about cancer screening and cancer detection and what we're able to do to change the lives of people who have cancer. So now, over the past 6 months, when people started coming back to care, people were presenting with more advanced stages of cancer. Had we been able to continue to do routine care and treating people in our hospitals and clinics. So yes, the over 800,000 people who've died from the virus, that's a huge, inhumane number. But we also have a large number of people, unfortunately, who've had these other diseases that have also been put off because of what this virus has done to our healthcare system.
You mentioned, and we've been mentioning, the amount of people that have died because of the virus. But according to the American Association of Critical Care Nurses, um, let me just say this. According to the World Health Organization, that is, upwards to 180,000 healthcare workers, those working in health, have died and lost their life to struggle. But those that are on the front line, who are risking it all, those doctors and nurses and patient care folks, are really there and really are absorbing some of the brunt of this virus, or the side effects, or the runoff or the fallout of this virus. When you think about the stress that they endure mentally, and the stress that happens to them, and how it has a physical effect on them as well. But just the fact that, again, the American Association for Critical Care Nurses did a survey back in the fall, and 92% of those that responded in the survey, of those 92% that responded, 66% said that because of what they have had to endure in the pandemic, they were considering leaving the profession.
Mm-hmm.
So it's had a profound effect. That same survey, those 92% of those that responded, 76% of them said unvaccinated patients threaten nurses' physical and mental health. And so, as a nurse, and those in the medical profession, pleasure do no harm. I think we forget that they are human. Mm-hmm. They are consummate professionals, but they are human. But let's take a look at a news story featured. I believe this one in one of the news outlets, about bringing us up close and personal to the struggle of those in healthcare.
Pretty, straightforward, unvaccinated, COVID positive patient with only single organ dysfunction, who seems to be holding his own on.
The last 2+ years has been a lot of different phases, a lot of different ups and downs.
His wife came to visit. He seems to be in good spirits.
Okay, good. And a lot of different challenges. And I think where we are now is in a situation with more COVID positive people in the area than we've ever seen. I will go in and talk to them. And we're faced with a potential to fracture our main strength, and that's the people that work here.
Andrea's been taking care of you. Yeah, you know her very well.
We have more patients today in a hospital that we've had at any other given point in time during this entire almost 2 years that we've been dealing with this pandemic. So just to give you an idea, right prior to Thanksgiving, we were averaging about 7 to 8 COVID patients a day. Now we're in the upper 80s. So a 10, 11-fold increase in just a few short weeks.
We're all rooting for you.
In our hospital, 70% of the patients that are admitted for COVID-19 are unvaccinated. An even higher percentage of those have severe illness, making it to the ICU, and over 90% have of those who die were unvaccinated.
Had I got the shot, maybe I wouldn't even be here. Yeah. But I know one thing. I don't have it as bad as a lot of other people in here. I do understand that. That's right. But the bottom line is, I believe that we need to get this shot. Yeah. And as soon as I'm able, trust and believe, I'm going to be the front line. If you don't have to go through some bad stuff, why? Why go through it? Yeah. Appreciate this. You hang in there, man.
And of the ones who are vaccinated, almost all of them have some type of comorbidity or they're immunocompromised. We see very few patients who are fully vaccinated and boosted ending up in the hospital.
So this is like one of these things where, it's not catastrophic COVID, it's COVID that sets the dominoes,
It's not COVID ARDS.
Right. It's the ripple effect, correct.
Well, it's overwhelming. It's completely overwhelming because I kind of feel like in a lot of ways we are where we were when COVID first came. The big influx of patients, how we have to change how we do patient assignments. They come a lot of times and they're admitted to the floor, but when they get really sick, they have to come to ICU.
I don't know what the sequence of events was. He came in bad shape and only went in worse shape, unfortunately.
I came in because I knew I had pneumonia. I could feel it. I couldn't stop coughing, and they took the COVID test and they came back and told me I had it. So because of my heart condition, they decided to keep me. I've had both shots. I was due to get my booster the end of this month, so I have to wait now, at least to next month. But I'm going to get it. No, my body fought it off pretty good. The vaccine really do work. If I did not get vaccinated or I did not come here, I may not be here to talk to you. I may not be here.
Last week I had a patient and we had to intubate him. And as we were kind of gathering equipment, Dr. Patel says, we're gonna do our rounds first and then we're gonna come back. I think he needs to be intubated. I said, okay, fine. So I went in and I talked to him, and it's scary to see all these people come in the room with masks and goggles and all dressed up. And he looked at me and said, I am trusting you to take care of me. And, you know, it just rips your heart apart. Unfortunately, he didn't make it. And how does that make me feel? I kind of feel like I failed him. But I also I wanted to say,
How are you doing?
if you've only gotten the vaccine, I wish you had gotten the vaccine.
Wow. Joining us right now, one of those frontline workers, Reverend Donna DeChain, who is a traveling nurse. Good evening.
Good evening.
Thanks so much for joining us. Watching that video, I'm sure you could relate. You could relate to what you were hearing from the doctor, what you were hearing from the nurses. Tell us a little bit about being a traveling nurse during these days and times, and the effect of this pandemic you see it having directly on people that have been affected by it.
Mm-hmm. Okay. Unfortunately, I guess the video froze, so I didn't get to enjoy any of that. I saw some spots, so if you want to fill me in, that's fine. But so if you have something specifically that you want me to address, then I can. But as far as being a travel nurse, I've been traveling all over the United States and Hawaii. I was my last assignment, which the effects of this pandemic on us is tremendous, and people don't realize it. We've heard comments about, where's your empathy, where's your compassion? And there was an article that was brought out by one of the doctors in Los Angeles, and she was saying, have I lost my empathy and my compassion? And it's basically relating to the fact that now that we have a vaccine, she was really questioning herself as whether she was uncompassionate toward those who are unvaccinated and still refusing care. We hear a lot of different things. It's not FDA approved. It's not this, it's not that. The information that was brought out was just really kind of unfortunate and confusing, even for us when it first started. We were told, oh, the healthcare workers are going to be the first ones to get vaccinated. We were like, really? Because we weren't given a lot of information. So some of us felt like, are we guinea pigs? We understand science, but can you give us the information, so that we can also inform others? You know what I mean? So some of that has been been problematic, but it's very, very, how can I say, uh, on our mental stability, it has been very hard just watching people, die. It's been 2 years, and you hear the conversations and the debates. And I know that, some of us do PTSD. There's times when I can't involve myself in another conversation because to me it's frivolous. As to why someone doesn't want to do this or what they're, and it's very hard to educate them because somewhere along the line they've made up their mind based on misinformation. Um, you know, um, and they don't realize that, like, I think I grew up in the era where, people had a sense of community, number one, a sense of responsibility. Adults had a greater share of responsibility in what they did and how they handled themselves. And meaning that, I remember being a child and our community was, given polio in immunizations on a sugar cube. And they had it at the local elementary schools, and the lines were wrapped around the block. You didn't hear not one grumbling. You didn't hear not one person talking about this is not, what we should do, or it's all right not to do it. I had an aunt that suffered from polio and was semi-invalid because of it. But as a child, I took a smallpox vaccination. I still had a scar. And I say all that to say that, my children and my grandchildren not have to have a smallpox immunization because I took it. And people don't understand the responsibility and the trickle down effect. We're watching now, and excuse me if I get emotional, because the problem I'm having with this whole pandemic is our babies. The adults that don't want to be vaccinated. Yes, you're right. But what are you doing to your legacy? After, repeated exposure, eventually those children are going to be affected as well. And that's what people don't understand. And then you also have there's a very small percentage of people who cannot take the vaccination. And I actually took care of a patient that had a genetic disorder that he had Factor X, Dr. Moss, and him taking that, being that it was an mRNA, that protein would affect him and cause him to have ill effects, basically, to explain it. However, he also had some slight respiratory issues. And in talking to his mom, I said to her, I said, because people don't realize this, it didn't just happen, And I said, has anybody been in your house? Has he been, exposed to anyone? And she was like, no, he hasn't been out. He's been pretty much staying home and for the last 6 months. And I said, has anybody been to your house? So she then, said, well, the only person was a nephew, but he didn't have it. Well, unbeknownst to you, he may not have had it. Because quietly, then she realized her son had been giving himself nebulizer treatments a little more frequently. So he did have it. And because of his Factor X, basically, his doctor said, oh my goodness, we're going to try the monoclonal infusions. However, he did have a slightly ill effect from it. We didn't know whether he was going to make it for a while. And 23 years old, So when we talk about vaccination and we talk about responsibility, it goes a little bit deeper than just saying it's my right not to have it and then want to try all of these things that you really are not an informed consumer about. When we talk about ivermectin and some other remedies that people, I lost a 27-year-old patient, 27-year-old female who had just had a baby. It took me back to 2009 when H1N1 was running rampant, and they were delivering babies about 6 weeks prior to their delivery dates in order to save them, and it just took me back to that. And we're seeing women who are being, induced, or having C-sections, that are exposed to COVID. And this young lady was delivered. She was flown to our hospital. Her mom took her baby home. We were FaceTiming. She stopped. She refused. She said, "This is too much on me. It's gonna make me want to go home, leave and go home." Now, this Delta version that we were dealing with at that time, the younger people were having different symptoms, and she was alert. She was oriented. She wasn't as short of breath and laboring as people would think. She was talking. But what I did notice was those patients were going quicker. Like they all of a sudden they're looking really good, like you and I talking, and all of a sudden they're in trouble and they're gone because there's no in between there. And that's what people don't understand. I had noticed that, a couple days after I had taken care of her, I'm beginning to notice, I'm saying her lips are turning purple, but she's still talking. And we've got BiPAP and CPAP on her, and whatnot. And she's not intubated. They thought about doing a few different therapies and whatnot. And I'm in the other ICU one night, and just as we're getting ready to leave in the morning, I hear code called, and it was her, gone, 27 years old.
Wow.
And she was unvaccinated, and, people don't realize, when you're carrying for two, carrying, a baby, you're kind of, the whole I said was you're closer to death than you really know in giving childbirth and whatnot. And it was just heartbreaking. And that thing sticks with me because as a mother, she'll never raise her two children. Her mother or her relatives will. And then you begin to wonder, while I was over there in Hawaii, we look at culture, we look at cultural things. There's a lot of Asian population there and whatnot. There was a lot of refusal to believe that, this needed to be addressed. So we look at culture, I struggle with it, being informed consumers at this point. I think you know what I'm talking about, Dr. Moss. We've given people and told them, it's your right to do this, your right to do this, your right to do that. It's your right to be informed. It's your right to be, an informed consumer, and it's your right to refuse. And I just think as a society, we have lost some things as a community, but it's heart-wrenching to go in. And when I was in Florida was a hot spot. We had 2 patients make it out of there. And then we heard that when we transferred the one, he died 4 days later.
Wow. Well, you traveled to Florida.
And we were like,
go ahead.
Yes. Your question?
You traveled to Florida, you've been to Hawaii, but the death looks the same. Suffering looks the same. The disease manifests itself the same. Regrets are expressed the same. Prevention could have had the same effect across the board. When you come into a patient's room and you realize that their disease, they're becoming progressively worse. Explain the decisions that are made by those attending to the patients when it's time to put them on a ventilator, and how long that takes and what that involves.
Well, first, let me say that there's no specific time limit as to. Well, let me explain it a different way. Case is typically different and the same. I know that's hard to understand. Some of the disease process continues on a trend. However, what people need to realize is the mutations are different. So each time you see a different mutation, you will see a different set of symptoms. You'll also see the speed of COVID and the ravages of COVID in each type, and that's why I differentiated between Delta and so like with Omicron, we see some other things, but I'll get into that. But when we first saw the first wave, the first thing that happens is we're all hit with what the heck is going on. What do? We don't know anything about this. From medical standpoint, and we're all like, okay, how's this going to play out? As it goes on, we know a little bit better, how this is going to play out a little bit. But we're talking 18 months in to this, and wow, we got another variant that is just as damaging. And I want to put it that way. Not that there weren't some in between, but we have another one just as damaging. And what it does to your lungs and stuff. So on the second rainbow, say this. When we first started seeing, everything was put out with the older adults, we're going to hit the hardest and this, that, and the other thing. There is a trickle down effect. And so what we're seeing now is the hard part, from last year to, now what we're seeing 20 to 50 years old being hit the hardest. Now, what happens with them is generally you have a population that's slightly healthier. We've had runners, but the problem is by the time they start feeling the effects of COVID, they're already in trouble. Why? Because they've had COVID in their body. They're losing oxygen. Your body muscles are depleted of that oxygen. Your heart is a muscle. So, people like, how they blaming heart attacks on COVID? Well, because heart and lung go together. If you don't have enough oxygen to supply your tissues, they die. Your heart seizes up. You have a heart attack. And so you're beginning to see the effects, which people didn't realize, that COVID has an effect of throwing microclots, so you're in danger of having a stroke. So you're seeing a younger population who is now having heart attacks and strokes from COVID. You know what I mean? And they're dying because they've had it longer. So it's had a chance to really, work on them. So in the 40-year-old population, what we were seeing too, the ones that were recovering, because I was up in Ohio last year at this time, we had a gentleman that recovered. We downgraded him eventually and sent him, to a little bit lower level of care within the hospital. And look around, and he's back in the ICU. We've had to intubate him again. And why? Because at that point, COVID really affected your lungs and caused you to have fluid, in lungs and stuff. So he was in danger all over again. And sometimes there is an after effect, so they're talking about long syndromes, short syndromes, and everything like that, which can linger and affect you and whatnot. As far as intubation is concerned, yes, there's a couple of things that happen. We look at oxygen saturations, but we also look at signs and symptoms. One of the things in critical care is you're not just looking at one thing. You're looking at a total picture. So I've had patients, families, come into a hospital setting and go, oh, his blood pressure's looking good, this and that. I'm knowing like he's got about 10 minutes to live, because there's other things that are going on that make it more damaging, critical, and life-threatening. So it's about a total picture. Intubation Exacerbation occurs when the person is so depleted they can't respiratory status on their own, and they need help. Sometimes it's temporary, sometimes it's a little longer term. We were seeing that typically when we ventilate people on ventilators, that within about 10 days, we usually start to give them a tracheostomy, and put it right here, so it's not as damaging to the throat. However, what we're seeing now is because COVID is so labile that we leave them intubated a lot longer before tracheing them. There's two things that are involved in that. The rate of infection, aerosolation, I think was part of it when we in the first legs of this and whatnot. And you have the survival rate, so it's like some of them were so sick we couldn't even take the time to trach them, because it's a procedure that you have to manipulate, you got to move, and they couldn't even withstand that. So there's various degrees of treatment, even the standard treatment, there's varying degrees of how we do it for each person.
Well, I wanted you to explain that because, again, as a deterrent and as to really the need for vaccinations, to let people know that if things progress, they could be in that particular situation, and how invasive that intervention is to preserve life. And so it's critical. Dr. Moss, I'm curious, as a person, as you've listened to Reverend Donna, and as you've seen the clip, what strategies can those on the front line employ to make sure they are not wounded healers?
It's a good question. There was a recent study that showed that, perhaps 49% of the folks who are caregivers in the midst of COVID, have burnout, which is a natural medical thing, feeling detached, a great deal of frustration, exhaustion, feeling as if your efforts are not very effective in being able to help save people. And people get very, very wounded, traumatized, depressed, and anxious with that. So there's some things that we try to do. We try to make sure that if we have folks who are on the front line in the trenches, taking care of people, that we try to make perhaps their shifts not as long, or they have other responsibilities in which they're not involved directly with the patients all the time. The challenge is that, sometimes we have people who are providing the care and they also get sick, or they have people at home that they have to care for. So being able to have enough nursing staff and allied staff to be able to take care of people, that's a problem for hospital systems.
Again, the American Association for Critical Care Nurses, 92% said that their hospital staffs are depleted.
Yeah.
And then there are some that do get sick themselves. Here's a story featured a while back on CBS about one frontline worker who actually got sick.
More than 14,000 healthcare professionals have contracted the coronavirus in the U.S., and at least 27 have lost their lives in the service of others. One of them, Pamela Orlando, documented her own fight with the virus on camera before she died. Lead national correspondent David Begnaud has her story.
56-year-old Pamela Orlando was a frontline hero.
This is a woman who had everything to lose, and she still went out there on the front line saving lives.
The nurse from New Jersey worked 3 jobs. She was a breast cancer survivor and a single mom to 16-year-old Ryan and 23-year-old Reed.
I begged my mother to not go to work. I really did. I begged her, but that's not who my mom was.
Pamela worked at the Valley Hospital in Ridgewood, New Jersey. Do you believe your mother was infected at work?
Absolutely.
From home, she started to document what would be the end of her life.
Today I have a fever that I can't get rid of. Day 2. Boy, do I feel like crap. Back pain, fever that won't break.
By day 3, she was hospitalized where she works.
Oh my God, this is no joke. I am so uncomfortable. My fever just broke, so I'm a little bit better. Fever of 104.6.
On the 5th day,
I feel horrible. I'm like so bad, like almost like I'm not gonna make it.
later in the day, she was struggling just to talk.
I can't even move without being short of breath. Just pray that I'm okay. Not sure what day it is. But I'm not getting better yet.
Pamela posted 5 more videos, but she didn't speak.
She was trying to log every day of the sickness to show the masses or whoever would watch it how this deathly virus can progress.
The day she died, April 16th, 24 days after she fell ill, Reed and Ryan visited her in the hospital, wearing proper protective equipment, along with their 80-year-old grandmother, Ann, who is Pam's mom.
She told my mom that she was going to take care of us and really protect us from anything. And that's what my mother really needed. She needed to know that me and my brother were going to be okay.
56-year-old Pamela Orlando died 2 hours after her boys went to see her. Gail.
David, that video is so tough to watch because you can actually see her slipping away. And what's painful to me is she probably knew she was slipping away, but yet she wanted to document this story in hopes of maybe helping others to let people know, as her son said, how bad this is. That's very tough to watch. And I feel for her sons who are watching this video and who she was.
You know, Gail, I spoke with a friend of hers who's a nurse at the hospital, and she said that every day she'd bring a phone to Pam's ear and she'd place it by the ear, and Pam was on a ventilator, so she was unconscious. But every time the boys would talk, her heart rate, which was beating rapidly, would drop considerably, and her oxygen levels would go up notably. And so that was a sign to the friend and the boys that Pamela could hear them loud and clear.
Yeah, and I think about the medical professionals too, David, who are now treating their own. As a medical professional, you don't expect to end up a patient yourself in most cases. And now many of them are in the hospitals as well. Thank you for sharing her story.
Bingo.
Thank you for sharing.
We can talk, we can throw out numbers. We can throw out numbers. We can talk about infection rates in different areas. But one thing that we cannot lose sight of are that real people have been and will continue to be affected by this virus. And I think sometimes there's a danger of, just as you said, Reverend Donna, earlier, the question was asked to you, have you become somehow desensitized by the whole, do you still feel compassionate? And I think for anyone who may not be working on the front lines, who has just been suffering from pandemic fatigue and somehow is able to empathize, let that video be a reminder that people are really leaving here as a result of being infected by this virus today. Thank you so much, Reverend Donna. Thank you so much.
Thank you
for all the work you're doing and sacrifices you're making, time away from your family, putting yourself at risk, just to help those of us who need your care and are given care, because I see the passion, I see the love for humanity as a whole. And I know that those that receive care from you have been blessed. just by your presence. I want to thank you. Dr. Mawson, in closing.
Thank you.
Dr. Mawson, in closing.
Just if you have not been vaccinated, please consider getting the vaccine. If you've had 2 shots, stay on top of your booster schedule. And if you're a caregiver, a medical professional who's been in the front lines with this, take care of your mental health, talk to other people about this, get the proper rest that you need, take care of your bodies. And if you feel overwhelmed, anxious, or depressed, difficulty sleeping or functioning, see a mental health professional, so that you can have someone to help take care of you in the midst of this.
In this time, especially to our viewers, those that are watching tonight, those that will to watch again as we rebroadcast this show, it's critical. It is so critical that you listen to the science and that you take care of yourself. And remember, we say it every week, but every week when we say it, we mean it. We really want you to feel better. We want you to become better, and we want you to live better. Have a good night, everyone.
Amen. Thank you.